5-year outcomes of gastric bypass in adolescents as compared with adults. Definition: bariatric surgery is an effective treatment for severe obesity in teens and adults, but is most commonly performed in the fourth or fifth decade of life.
So gastric bypass is a procedure that has been around the longest in the United States. It's a procedure that will create a small pouch of your stomach, kind of the shape of an egg. And then we're going to go and divide your small intestine to bring that up to this egg-sized pouch. It's going to reroute how your food is digested, so it's going to go into your pouch and your small intestine, but the enzymes that break down that food are not present until later. So you get a restrictive portion, you don't have as big of portions. You also don't get as much hunger because it impacts hormone production. And then you don't absorb all the calories that you do eat. It is safe. You will not lose too many calories that you're eating, but it allows you to lose further weight than some other procedures.
Applications in medicine. The accumulated effect of sustained obesity from adolescents thought might increase the likelihood of complications and death related to diabetes and cardiovascular disease. Adults that report severe obesity during adolescence seeking bariatric surgery will be more likely to present diabetes, hypertension, respiratory condition, kidney dysfunction, walking limitation, and venous edema in the legs and feet than the ones who didn't report severe obesity during this year.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. The upper portion of the small intestine is reconnected to the lower part of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Pros and cons. Pros. This procedure during adolescence would be associated with the greater likelihood of remission of coexisting conditions that the same surgery performed in adults who had been obese since adolescence. Improved obesity-related reversible physiological functional mechanisms that underpin hypertension. Cons. Short-term complications, wound infections, excessive bleeding, breathing problems, long-term complications, vomiting and diarrhea, abdominal hernias, malnutrition.
For most teenagers, worrying about things is a normal part of growing up. But teens who are severely obese may worry about being able to walk around and keep up with their friends, or even whether a building has an elevator so they don't have to climb several flights of stairs.
And what this can do is really decrease the quality of life for these individuals.
Bariatric surgery
is a viable treatment option for youth with severe obesity. But with that comes risks, but also comes substantial benefits.
Doctors Justin Ryder and Aaron Kelly from the University of Minnesota School of Medicine and co-authors are tracking long-term outcomes for 242 teens that underwent bariatric surgery at 5 centers around the U.S. Surgery like this one, performed by Dr. Thomas Inge at the Cincinnati Children's Hospital. The current study includes 206 of these teenagers and focuses on improvements in mobility and joint pain. All patients participated in a quarter-mile walk test before and after surgery.
We figured from the outset that bariatric surgery, because of the magnitude of weight loss that accompanies it, that these teenagers would be able to walk further and have less pain. But we were surprised about just how much that improved.
The study appears in JAMA Pediatrics.
They were able to walk this distance faster and with a lower heart rate, indicating that their fitness levels improved.
They were about 30 seconds faster at 6 months, and those benefits were sustained up to 2 years post-surgery.
In addition, they were able to do it relatively pain-free compared to before they had the surgery. Many of them will be more likely to engage in physical activity and exercise over time, which we think will give them a better shot of keeping the weight off in the long term.
Catherine Dolph, The JAMA Report.
Issue applied in Ecuador. In Ecuador, bariatric surgery is becoming more accessible to the patient. This surgery has a price that fluctuates between $6,000 and $9,000. In numbers, it seemed a little expensive, but if you compare it with the benefit that this procedure will produce in health, it is eventually a good investment.
Have you worked hard to lose weight, only to gain it back? Do you feel like it's your fault when this happens? That you're a failure and just don't have the willpower to succeed? Society judges obesity as a personal failing, but it's not. What most people don't realize is that obesity is a disease. Due to biological factors, losing weight when you're obese is not simply a matter of diet and exercise. Based on the hard lifestyles of our ancestors, our bodies are programmed to store and maintain energy in the form of fat when we feast, so we have energy reserves available for times of famine. When you lose a lot of weight, your body believes it is in danger and pushes you to regain the weight and replenish your energy stores. It does this by increasing hunger and food cravings, and by going into economy mode, or burning energy at a much lower rate. So you may be working hard to eat healthy and exercise, but find your hunger and cravings have increased. And for some reason, no matter how much you exercise, you can't keep the weight off. At Columbia University Irving Medical Center, we understand how difficult this struggle can be, and offer a wide variety of treatments from medication to surgery for obesity. Weight loss surgery is proven to help keep weight off. It can help reduce hunger, make smaller meals more satisfying, and give you back some control over your weight. Through our Weight Loss for Life program, over the past 20 years, we have helped thousands of patients successfully lose and keep off their weight. Take control of your weight today and make an appointment with us.
Conclusion. Gastric bypass is a weight loss surgery which is the most effective treatment for morbid obesity, producing durable weight loss, improvement or remission of comorbid condition and longer life. Even though it's common performed on adults, adolescents have better outcomes after the surgery is performed.
JC Vermillion struggled most of her life to lose weight through diet and exercise alone, so like a growing number of teenagers, she had bariatric surgery and in just 90 days lost more than 70 pounds.
It's made my life so much better. I'm happier and I'm getting to know more people, and it's just changed everything.
But JC's life may have changed even more than she realizes. Before undergoing weight loss surgery, every teenager is put through rigorous testing. But in a recent study, researchers at Nationwide Children's Hospital took it a step further, doing sophisticated tests on the teenagers' hearts as well.
What we found was that the cardiac structure and function in these extremely obese adolescents scheduled for bariatric surgery was much more impaired than one might have thought.
Working with fellow colleagues at The Ohio State University, doctors performed cardiac MRIs on teen patients, and while following 10 of them for a recent study, they found many had hearts that were larger and much less efficient than normal. But after weight loss surgery, that changed.
Many of the abnormalities that we documented during the initial baseline study actually showed significant improvement after the weight loss had been obtained.
In fact, the study found that enlarged hearts got smaller, blood flow improved in all the patients, and in 60% it completely normalized. Because they are young and rarely show cardiac risk factors, few patients like JC ever get high-tech heart testing before surgery, but this study may help change that.
The bad news is that they probably are at more risk than most people had considered. The good news is that bariatric surgery definitely has the capacity to reverse some of this at least.
At Nationwide Children's Hospital, this is Clark Powell reporting.
Thanks.